thank you for speaking out on behalf of people with disabilities. We needed to hear that. I want to call on a friend of mine sitting out here who I've noticed, Dr. Ken Thorpe, who is a leader in chronic care management nationally, has done a lot of work and research on this, and see if you have any thoughts about what you've heard today.
Actually, that was not a plan, so just... No, thanks, Nancy Ann, and thanks for all the good work you're about to do, and Governor Patrick, Governor Douglas, for all your leadership in this issue. It seemed to me, I've sort of heard four things today that it seems that there's a fair amount of consensus about. One, in terms of primary prevention. We know that about 30% of the growth in healthcare spending is linked to a doubling of obesity in this country since the mid-1980s. So healthcare reform has to find a way to do a better job of preventing disease in the first place. And that really is going to involve not just the traditional healthcare system, but it's going to take things like school-based interventions, community interventions, workplace interventions, really much more population-based public health. So that's one thing I've heard. The second thing that Governor Douglas talked about was the fact that 75% of healthcare spending is linked to chronically ill patients. So unless we find better models that are more holistic, that focus on the patient, much of it delivered outside the traditional physician's office, that deals with social workers and mental health workers and dietitians and nutritionists, we're going to have a very hard time in bending the curve in rising healthcare spending. And for those of you, and going back to Washington, I would just simply say that these community health teams, community care teams here in Vermont are a tremendous model to think about nationally. So that's the second thing. The third thing that I heard was the issue around universal coverage. And I would just hope that this time around, this is when we get all bollocks up in, right? So everybody's got a first choice, and everybody's second choice is to do nothing, the status quo. So I would hope that we think about some ways to do some compromise, to think about some middle ground, to give some choice in the system, but to remember that really at the end of the day, what's I think most important is in getting everybody covered. And let's not get us killed in the details. We can fix the details later, but let's make sure that this time around we get everybody covered. The last thing, just quickly, is that we have got to find a way to make the system simpler. We spend way too much in administrative costs. We can do a much better job simplifying the system, not just for the patients, but for the hospitals and for the physicians, for the healthcare providers that work in the system. So those are sort of the four things that I took away. And again, just in closing, thank you for both of your leadership, and Nancy Ann, good luck with your new venture.